What if your loved one isn't clumsy, but their brain is lying to them? Depth perception loss in dementia is real and dangerous. Here's what you need to know before another fall happens. Hi, I'm Rick Henkin. My wife Sonia was diagnosed with Alzheimer's in January 2020 at the age of 65. I've seen too many caregivers suffer physically, emotionally, and mentally, oftentimes more than the loved ones they care for. I was determined not to let this disease take me down, and I found a way to cope. Now I help other caregivers do the same. In a previous video, why dementia behavior changes minute to minute, I talked about how seemingly simple things like going from sitting to standing, or the reverse, can cause Sonia to pause and not move because her brain can't process what she needs to do, even though she might have just done that task earlier in the day. A neighbor reminded me of something else, something that might be affecting your loved one with Alzheimer's, but doesn't always get the attention it deserves. Depth perception. You know how we typically take for granted that we can tell how far away objects are or how to navigate around a room? Well, that's what depth perception is all about. But for someone with Alzheimer's, the seemingly simple ability can get really tricky, making everyday life and caregiving more challenging. Imagine trying to walk down the hall and suddenly everything feels off. The brain's ability to process visual information starts to change as Alzheimer's progresses. The eyes might be fine, but the brain's getting mixed signals. So things that were once second nature, like judging where a step ends or how far away the coffee table is, start to feel confusing. This change can be more than frustrating, it can be alarming. Picture this. You reach for a glass of water but misjudge how close it is and accidentally knock it over. Or maybe you try to step down from a curb and can't quite figure out where the edge is. It's not just a nuisance, it's disorienting. No wonder our loved ones might seem hesitant or less confident when moving around. It's not just about being careful, their perception of the world is literally shifting. And let's talk about safety for a second. Have you noticed your loved one hesitating on stairs, stopping before stepping onto a patterned rug, or reaching out for support? More often, it's likely due to depth perception issues. Dark rugs might look like gaping holes to them, while shiny floors might seem wet or uneven. Suddenly, a simple step or change in floor texture feels like an obstacle course. And it's not just inside the house. Even a short walk outside can feel like a minefield. Uneven sidewalks, curbs, and different surfaces like grass or gravel can all cause confusion. It's understandable why someone with Alzheimer's might feel anxious about moving around, right? No one wants to fall or feel embarrassed by a stumble, so they might start moving less or avoiding certain areas altogether. Now think about how this affects your daily routine. Simple tasks like pouring a drink or sitting down in a chair become daunting. Your loved one might reach for a doorknob and miss, or try to grab their toothbrush and knock it over instead. Sometimes it will literally take Sonia a minute or more to step off the curb and then get into the car. She hangs onto the open door for dear life while trying to figure out how to navigate the step down from the curb and then the step up into the car. It's frustrating for them, and let's be honest, it's frustrating for us too as caregivers. But it's more than just the physical challenge, it's emotional. Imagine constantly misjudging distances, struggling with basic tasks, or having to second guess every step you take. It's not hard to see how this can lead to feelings of embarrassment, anxiety, or even anger. They might start avoiding activities they once loved, all because they don't trust their vision. And for you as a caregiver, it's heartbreaking to see them withdraw from things that used to bring them joy. So, what can you do to help? I know this sounds like a lot, but there are practical ways to help your loved one feel more comfortable and safe. Here are a few ideas. Better lighting. Make sure rooms are well lit, especially in those tricky areas like hallways, stairways, and bathrooms. Bright light helps reduce shadows, which can make things appear more clear and more defined. Use contrasting colors if you can. Add contrast where needed. For instance, try using bright tape at the edge of steps, or put darker placemats on a white table to make objects stand out. Another thing you can do, clear the clutter. Keeping walkways clear can make a huge difference. It's all about minimizing potential hazards. Even simple things like securing loose rugs can prevent tripping. Install handrails if you haven't already. Consider adding handrails where needed. It's a straightforward way to provide extra support and boost your loved one's confidence. Encourage safe movement. Despite the challenges, don't shy away from encouraging movement. Gentle exercises like chair yoga or slow walks on flat surfaces can help maintain mobility without overwhelming them. Here's another one. Be an outdoor buddy. If they enjoy being outside, try to be there with them, whether it's a short walk around the block or just some time in the garden. Having someone to lean on can make the experience less intimidating. Now, I get it. Dealing with depth perception issues is just one part of the Alzheimer's journey, but it's a big part. It's not just about making sure they don't trip, it's about helping them feel more safe, more confident, and more in control of their environment. And that sense of comfort can go a long way in reducing anxiety and restoring a bit of their independence. At the end of the day, caregiving is all about adapting. Every small adjustment you make is a win for their safety and quality of life. So while depth perception changes can't be reversed, your efforts to understand and accommodate them mean more than you might realize. Every step, literally and figuratively, toward making their environment safer is a victory, and that's worth celebrating. Have you noticed your loved one hesitating at rugs or stairs? Tell me what you're seeing. I read every comment, and you're never alone on this journey. If you're feeling overwhelmed, exhausted, or like you're losing yourself in caregiving, you're not alone. That's exactly why I created Caregiver Mastery, a step-by-step roadmap designed to help you manage stress, anger, and burnout so you can care for your loved one without sacrificing yourself in the process. Inside, you'll learn how to say yes to yourself without guilt, reduce overwhelm, and find peace, even in the hardest moments. I call this place Heaven Island, a state of peace, acceptance, and clarity, where you can care for your loved one without losing yourself. Now, it's time to give yourself permission to breathe, to rest, and to heal. Click the link below or visit caregivermasterycourse.com to get started today. If this video helped you, please like, share, and subscribe. I post caregiver support videos every Monday and Thursday. You're not alone in this. Let's do this together.